Hello and welcome back to GP Video Podcast by Nadia. Today the topic that I'm going to talk about is called Metabolic Syndrome. Does it ring a bell? No? I'll tell you now. So before I start Metabolic Syndrome, I would like to talk to you about something that we encounter in every other patient, or maybe in every patient that we see in general practice, in us, in family around us, everybody. I usually say in the world of diseases or in the world of health, there are three siblings that usually are seen together. Now, who are these three siblings? They are high cholesterol, high insulin resistance or sugar levels, or type 2 diabetes mellitus, high blood pressure. These three siblings are usually together. Yes, there could be only one of them, there could be only two of them, or there could be three. Usually these three, if there is one missing, the other one just comes out. Why? Because high sugar levels or high insulin resistance would eventually lead to high cholesterol levels if you already don't have it, because high sugar consumption lowers the good cholesterol and increases the level of bad cholesterol. So if you already have insulin resistance, in which your cells are not responding properly to insulin and sugar is not being consumed, so that sugar actually then will lead to high levels of bad cholesterol, and then high levels of bad cholesterol, if you already do not have high blood pressure, will lead to clogged arteries and will lead to high blood pressure. So high cholesterol, high sugar levels, high blood pressure, all of them together. Now, these three siblings are usually parented by one risk factor or one condition called high body mass index or obesity, or high BMI, obesity, or being obese, or being overweight. So these three risk factors are actually parented by that. So what is this? This is called metabolic syndrome. So metabolic syndrome is basically defined as a cluster of risk factors that together increase a person's risk of stroke, brain stroke, heart disease, and type 2 diabetes mellitus. So, or what are these risk factors? These three siblings and that one parent that I spoke about. High blood pressure, excess abdominal weight. They basically, when they talk about obesity in metabolic syndrome, they talk about abdominal weight or waist circumference more. Low levels of good cholesterol and high levels of bad cholesterol, which is low levels of good cholesterol, which is HDL cholesterol, and high levels of bad cholesterol, which is LDL cholesterol. And number 4, insulin resistance, where your cells don't respond to insulin and your blood sugar levels rise. So what is metabolic syndrome? It is a cluster of 4 conditions, 4 risk factors, 4 things that all together increase the risk of stroke, heart disease, and type 2 diabetes mellitus. Among these 4 risk factors, I called 3 of them as siblings: high cholesterol, high sugar levels, high blood pressure, and they are parented by obesity or high BMI, or being obese, or having excess abdominal weight. So these are the 4 risk factors that we will be talking about in metabolic syndrome. How they can be prevented. If one is present, how can we prevent the other one to happen? What are the lifestyle changes that we should make? What are the exercise stuff that we should be doing? And then finally, is there any pharmacological treatment for it or not? Stay tuned.